Institutional Strategies for Crisis Preparedness and Mental Health Promotion. Over the past 11 lectures, we have explored how to support Ukrainian students coping with loss and trauma through empathy, communication, creativity, and inclusion. In this final lecture, we will look at the bigger picture: how universities can build institutional systems that sustain these efforts beyond individual actions or short-term projects. A university prepared for crisis is not one that prevents every problem, but one that responds with coordination, compassion, and continuity. What strengthens such systems is not intuition alone, but also evidence. The recently uploaded UkraStud research provides strong empirical support for the institutional strategies we will discuss today. It shows what actually works for Ukrainian students across multiple countries. Let's look at 4 pillars of institutional crisis preparedness and mental health promotion. Number 1. Prevention and early detection. Prevention begins with awareness. The research clearly shows why this matters. According to the results of the research, satisfaction with inclusion policies is one of the strongest predictors of psychological flourishing. This means that when students feel supported early by administration, tutors, or buddies, their well-being improves long before crises emerge. Students across all countries report significantly more positive than negative interactions with peers and host communities. Positive campus climate is therefore a protective factor in itself. This supports the need for regular workshops for tutors, faculty, and administrative staff on recognizing early signs of distress can stop crises before they escalate. Universities can also conduct anonymous well-being surveys to monitor stress levels and identify emerging needs. Peer networks, mentoring programs, and resilience-building activities such as mindfulness groups or creative clubs all serve as preventive buffers. Number 2. Clear crisis response protocols. Our research highlights that students flourish when institutional structures are predictable and transparent. For example, Ukrainian students show high satisfaction with administrative support and inclusion structures across all host universities. In other words, clear and responsive systems reduce uncertainty, a major source of stress for displaced or trauma-affected students. In Ukraine itself, satisfaction with the inclusion policy is even more strongly predictive of well-being, showing the importance of institutional clarities in crisis contexts. Every institution should have a written, accessible plan detailing who does what in a crisis. This includes emergency contact lists and referral pathways, procedures for communication between tutors, counselors, and university management, guidelines on confidentiality, documentation, and follow-up. Regular simulation exercise can help ensure everyone knows their role and acts swiftly during real emergencies. Number 3. Integration of mental health into academic life. One of the most significant findings of the study is that mental health is closely linked to academic success. The results of the research show: among students in Ukraine, positive contact with international peers and foreign communities significantly predicts academic performance, while negative interactions lower it. This means that mental well-being and social climate directly affect learning outcomes. Across all countries, psychological flourishing remains high when students feel included, aligning with the idea that well-being must be embedded in education, not treated as an add-on. Promoting well-being is not just the job of counselors, it's the responsibility of the entire academic community. Universities can embed mental health awareness into orientation sessions, include psychoeducation in curricula, and provide self-help materials online. Academic flexibility, such as compassionate leave or exam deferrals during grief, shows students that well-being is valued as much as performance. Collaboration between departments, psychology, education, administration ensures a holistic approach. Number 4. sustainability and continuous improvement. The research findings reveal another key insight. Positive intergroup contact does not only improve well-being, but it also strengthens pro-European attitudes and identification with Europe. This matters because identification is linked to trust, belonging, and long-term social integration. Sustained, structured support systems have long-term measurable effect on flourishing and self-efficacy. This shows that mental health promotion cannot be a temporary project. It must be a continuous institutional commitment supported by partnerships, evaluation, and long-term planning. Mental health promotion must continue beyond project timelines. Establishing partnership with local NGOs, Ukrainian psychological associations, and international mental health networks can help sustain services and expertise. Regular evaluation allows institutions to adapt programs to real needs. A sustainable system is one that learns, grows, and evolves with its community. Institutions that prioritize crisis preparedness and psychological health send a powerful message. Education and care are not separate, they are inseparable. Investing in mental health is investing in human potential. It strengthens academic performance, community resilience, and the moral fabric of the university itself. As we conclude this course, remember, every conversation, every policy, every act of kindness matters. You, as educators and tutors, are not only transmitters of knowledge, but also guardians of hope. Together, we can build universities that heal, include, and empower, even in the face of loss. Thank you for your attention and for your commitment to supporting Ukrainian students with compassion, dignity, and courage.